very special guest here with us, Mrs. Donashin. She's here to share experience. She's a nurse in infection prevention and control, and she's an expert in this field. And she'll be sharing our experience over the years in this area and how IPC is very essential in combating AMR. Once again, I want to say a very big welcome to you, Mrs. Dilnashi.
Thank you
Thank you.
very much. You pronounce my name very beautifully. Thank you very
Thank
much
you.
for inviting me. And it's a great chance to share my experience and challenges we are facing in Pakistan.
Do you want to briefly tell us about your background and
Yeah. As you know that my name is Dilnashin Safdar and I am a registered nurse over here in Pakistan. I recently completed my master's in the hematology oncology. Basically, I'm working with a patient who have blood disorders and in the department of bone marrow transplant, which is very crucial because as we all know that the neutropenic patients are immunocompromised and very prone for infection. In 2006, I joined the oncology department. At that time, I realized that the most important thing for this patient is infection prevention and control. So that I joined my infection control team and I did many courses from St. Jude's, Memphis, USA for infection prevention control, and I enrolled in the diploma of infection prevention control at Indus University Hospital, Karachi. And this is my mission that every nurse should know about the basic infection prevention and control. That's why I'm in this field.
that's a very lovely experience. And thank you very much for sharing that with us. Can you tell us a bit about your role as a nurse worker in Pakistan?
Yes, in Pakistan, actually, nurses are not empowered in the last 2 decades. But recently, the nurses have a chance to grow with the education. That is a great master's in oncology or master's in other fields. So that as a nurse, we have very challenges for the empowerment and to show ourselves and to play a role in the treatment and recovery of the patient. Like as I believe that a nurse and doctor they are working parallel. But in Pakistan, the most of people think that nurses are working under the physicians or doctors. But no, in my point of view, the nurses are working parallel with the physician or the doctor. So the decision of both professionals are respectable. So we know our patient very well. In Pakistan, we are trying that a nurse have their own decision and will share the physician.
That's very interesting to know that the nurses are very much involved with their patient. Give us an overview of the infection prevention and control challenges that is being faced in healthcare settings in Pakistan.
All over the world we have challenges regarding infection prevention control, but Pakistan is a low middle income country with low resources. We have many challenges and sometimes the behavior change. Sometimes we know all these things, we have resources, but we are not doing that. That is the behavior change. Need to change the behavior of the healthcare worker to tell them that this is essential for not only for the only patient, this is for yourself and for the community and for the coming antimicrobial resistance.
Thank you very much. And I can pick three main points that you highlighted here. Number one is that you are short-staffed when it comes to nurses that are well trained in IPC. And
Yeah.
secondly, the resources are also unavailable. Thirdly, the issue of behavioral change, even among the
Yeah.
healthcare workers. That's indeed a major challenge. Thank you for
Yes.
sharing this with us. Your experience, how significant is the issue of AMR in Pakistan? And what impact have you seen it have on patient and healthcare systems?
Like chicken and the buffalo where we get the milk, they are injected with the antibiotics so they can breed more rapidly, they can give more milk. So this is also a source of antimicrobial resistance. So when there is use of antibiotics which is not controlled, the resistance are going up, and the expenses are going up, and we have nothing in our hand to treat our bugs, and so can't do anything. In Pakistan, there is no control over the medication. Everyone can buy over the counter medication like antibiotics and painkiller, anything, and anyone can prescribe which they want. Only I think few hospitals in Pakistan, four hospitals, they have antibiotics to a ship over here. So other hospitals, physicians are prescribing medication they require. That's why we have a huge number of multi-resistant organism over here. So we have to control antibiotics. There is a rise in the expense of the patient and also in the healthcare facility. And that rate, we lost our patient with these antimicrobial resistance. So this should be controlled, and the impact will be improved with the improvement of the prescription of the antibiotics, so that we can control these antimicrobial resistance in this
Thank
patient.
Thank you very much for sharing that. What are some of the common infections that you encounter in your day-to-day work, and how does antimicrobial resistance complicate treatment of these infections?
Sometimes we have very commonly Pseudomonas and Klebsiella positivity in our patient. It depends upon the condition of the patient. As we are dealing with a neutropenic and immunocompromised patient, we should take care of every bug, that our patient should not infect it with smallest, or with the dangerous, with the resistant or pan sensitive. All these microorganisms should be prevented in the healthcare facility, especially the patient who are immunocompromised, elderly, or the children.
So if I get you right, AMR infections have been affecting immunocompromised vulnerable populations in Pakistan in your healthcare.
Yes,
Okay.
yes.
So what are some of the IPC protocols that are currently in place in your healthcare facility in order to prevent the spread of these infections?
Yes, primarily in most of the hospitals, we try to implement the hand hygiene. So the disinfectant should be available, and hand hygiene. Every healthcare worker should perform the hand hygiene, proper and justifiable use of PPEs. Because this is very common that a nurse is wearing glove, and she is just typing the medication on the computer, and she is opening the door with the same hand, and she is performing procedure with the same gloves. So like housekeeping staff just transporting the waste man from the one room to another area of where they store, they are wearing the same gloves. So justifiable use of PPE, I try to that, hand hygiene, and the justifiable use of disinfectant, proper disinfectant which is with the proper dilution. Because sometimes we are using the surface disinfectant or the floor disinfectant, but the dilutions are not proper. That is waste of money, waste of time, and we are unable to get a proper outcome which we want to implement all these practices, from the basic hand hygiene to the maintenance of the pressure of the room.
Thank you very much for that. So, how do you handle challenges like shortage of supplies, like the personal protective equipment and disinfectant that you mentioned, or even the lack of infrastructure that could hinder your IPC efforts?
In 2012, we involved in a project that is AAA project, and they told us how you handle these things. So that time I learned, and I am apply many of these practices in the remote area of Pakistan. That is a basic health unit. That where we don't have the hand disinfectant, we take spirit, we put in a ketchup jar, and we put some glycerin in it, and we label it the hand disinfectant and put on the table of the doctor, and just told them that use this disinfectant before and after handling the patient. So this is very effective. When we don't have much branded hand disinfectant, we can use alcohol with the glycerin. Like we have 10 ml alcohol, we should use 1 ml glycerin, And for the disinfectant, when we don't have any disinfectant in these areas, there's a basic health units. We told them take bleach, so for a glass of water and 1 glass of bleach, and make it 0.5% your bleach solution, and just write down the date and time on the bottle, and use within 24 hours to clean the surface and floor for disinfection. And also you can use this solution the toilets or washroom. So these are the low resources we are generally recommended for our basic health units where they don't have hand washing facility. And give a towel to every individual, that is your towel for your one shift, and just wash your hand and then put this towel in the sunlight. So these are some low facilities over here. So we advise in the remote area, in the basic health units, that use these things.
From what you've said, I can see that you had to do a lot of improvising to
Yeah.
make sure that these PC materials are actually available. And these are
Yes.
some of the challenges that we encounter, especially in low and middle income countries.
Yes.
And I would like to ask, when it comes to community engagement, how do you educate patients and their families about infection prevention, particularly in the fight against AMR?
Yes, this is a continued process. This is not only one time. When the patient comes first time, one nurse, that is the infection control nurse, designated for the education and training of the IPC's practices, and she or he told everything to the mother, father, if the patient is a kid, or the patient and a caregiver, that how to wash your hand washing, which are the proper steps, and which area you should cover, and how much time you will give to the hand wash, and where you should wear the mask and where you should wear the gloves. So from the first day when patient came in the hospital, we educate them. The nurse remind patient and the caregiver about all practices, because when once we explain or train or educate a patient or the caregiver, they not remember all these things. So we daily hammering. Do you remember? Okay, show me how you wash your hand. Okay, you know that this is your responsibility to tell your brother. Your brother will tell your sister. So this is a chain that is sharing with the other patient. And sometimes the smart caregivers or smart patient, we invite them to come over and explain all the patients and the caregiver how you can do hand washing. So we are emphasizing on the hand washing and proper use of PPEs, because our patients are neutropenic, immunocompromised. So we encourage them to wear masks and sometimes gloves, but all the time we encourage them to wear masks.
That's very good to know. And I like the fact that you mentioned that after training the patient, that also help to train others, which is a very nice concept. What are some of the social and cultural factors that affect IPC practices or misuse of antibiotics in your community that you have noticed over time?
Many of our patients are not taking proper antibiotics. This is very common in Pakistan. That the physician prescribe medicine for the 7 days, but after 3 days, when the patient feeling well, they stop their medication. And secondly, they are just doing the over the counter, taking the medicine from over the counter. And sometimes this is also the behavior of our population here, that if one member get prescribed any antibiotic and the other member have same symptoms, they are taking the same medication with their own, without consulting doctor, without consulting any healthcare. So these are some factors which are in the community, which I think can be contributing to the antimicrobial resistance in Pakistan.
There's a lot of self-medication that is going on, and
Yeah.
when people use the antibiotics and they feel it works for them, they automatically recommend it to their colleagues or their friends without consulting
Yeah.
the doctor before use. Thank you for sharing that. What is the role of government policies in improving IPC and combating AMR in Pakistan?
The government in Pakistan have 5 provinces over here. Punjab province, one of the province of Pakistan, the government of Punjab is very strict. The infection prevention control, they have many guidelines and also have a team on the government level. And in the province of Punjab, it is necessary that every hospital should have infection control team. Even if they don't have team, should have one infection control nurse who are taking care of all the education and training of the healthcare workers and the waste management and the use of antibiotic. But if you say that in the government level, overall the national level, we don't have much policies about the antimicrobial stewardship. We are working on that, but not much policies or guideline that.
How important is collaboration between the nurses, the doctors, and other healthcare professionals in implementing effective IPC measures?
Yeah, this is teamwork. The infection prevention control is the responsibility of everyone, and this is a teamwork. And most important are a physician, a nurse, a pharmacist, and the housekeeping. Because if your housekeeping staff is not well trained, they are not aware of all these practices, even we face a disaster over here. So communication between these stakeholders, nurses and pharmacists and the physician is important. And sometimes nurses suggested many things that they observe from the patient. If they find that you are overusing of the antibiotic, physician should respect that point and should review the antibiotic if a nurse notify. And as that the pharmacist should share their point of view with the physician and the nurse of that patient. So this is very important, and we try to promote in our institute operations.
Thank you for sharing that. So teamwork is very, very essential. When it comes to technology and innovation, have you seen any innovative solutions such as digital tools or new technologies that are being used to improve IPC in your healthcare settings or in the hospitals in Pakistan?
In 80% of hospital, they don't have any digital technology for AMR. Only few hospitals in Pakistan, which they have these facilities over here, but in most of the hospitals they don't have.
Can you share a success story where effective IPC measures significantly improved patient outcomes or even reduced the spread of infection in your healthcare facility?
The most important thing is awareness, education, and the training. The IPC person should be well trained, and he or she should know how to train other person, how with the other healthcare worker or with the layman, which point the community should know about the infection control, and which point should the healthcare worker know in hospital. So the education and training and awareness. My hospital, I told my nurses that three things are most important for the successful outcome of the patient. The first is the infection prevention control, second is the infection prevention control, and third is the infection prevention control. So if you want a good outcome, you should have a strong and a well trained infection control personnel over there. The first thing is awareness, well skilled and educated infection control practitioner in every hospital and also in the community. So we should train, we should community, our students, our college, so they spread the awareness so we can control the antimicrobial resistance in our community, which is a big challenge for us, especially in the low middle income country.
Thank you very much.
Yes, obviously, in a hospital, that like you say, in the wards and in the clinics, most and in the laboratory, these practices should be implemented not only inside that is a high dependency unit like ICU, the transplant unit, the OT. These are the high risk area, but we should also pay attention in the outpatient departments where we have patients with the multiple disorders and different diseases background. So there we should segregate these patients. These are the high risk. In my experience, we breach all our practices in our outpatient departments. The doctors and the nurses are not even doing hand wash properly over there,
Mm.
so that we spread the infection from an infected patient to a healthy patient who is just come over there for checking the blood pressure, or only for the follow up, or only asking for a procedure before the surgery. And you check a patient who have multi drug resistance, and you catch the infection and you touch that patient without hand washing. This is a main source of transmission of infection. And when that patient admit in the hospital, in the ward, he is the source of that infection.
We should
Practitioner
take care
in
of
every
the hand
hospital
washing.
and also in the community. So we should train, we should community, our students, our college, so they spread the awareness so we can control the antimicrobial resistance in our community, which is a big challenge for us, especially in the low middle income country.
Thank you very much.
Yes, obviously, in a hospital, that like you say, in the wards and in the clinics, most and in the laboratory, these practices should be implemented not only inside that is a high dependency unit like ICU, the transplant unit, the OT. These are the high risk area, but we should also pay attention in the outpatient departments where we have patients with the multiple disorders and different diseases background. So there we should segregate these patients. These are the high risk. In my experience, we breach all our practices in outpatient departments. The doctors and the nurses are not even doing hand wash properly over there,
Mm.
so that we spread the infection from an infected patient to a healthy patient who is just come over there for checking the blood pressure, or only for the follow up, or only asking for a procedure before the surgery. And you check a patient who have multi drug resistance, and you catch the infection and you touch that patient without hand washing. This is a main source of transmission of infection. And when that patient admit in the hospital, in the ward, he is the source of that infection. Thank you very
Thank
much
you.
for inviting me. And it's a great chance to share my experience and challenges we are facing in Pakistan.
Thank you.